I remember Dr. Gap Legaspi nung unang na-designate ang PGH as a COVID center. I remember he had a letter to the PGH, really a rousing, stirring, very inspiring message. I'm just wondering, what was his message to the PGH staff and to all medical frontliners heading into this, given knowing that they have their rights to refuse, but at the same time, knowing that all eyes are on our doctors?
That's correct. What happened was, in the beginning, there was news, di ba, when there was the Senate hearings, they heard it was Sinovac was a done deal, and it was the one arriving. So many of the people in Philippine General Hospital who volunteered, you know, when we volunteered to be a COVID hospital, many of the doctors and nurses were against it. Said, there are other public hospitals, why are we the ones volunteering? We need to serve the others. So there was resistance in that time. So when after that, everybody sacrificed, maraming nagka-COVID. However, nung ibibigay ay Sinovac, na-demoralize yung mga personnel. So we had a survey without asking which vaccine. Majority naman wanted the vaccine. Pero mukhang may brand consciousness nga. There is a lack of trust to vaccines that are made in China as compared to companies from the West. Siyempre, the doctors know these are old pharmaceutical companies that have been making vaccines for a long time. So nagkaroon ng konting vaccine. I think today, it showed na mukhang nawala because after the town hall, parang we couldn't even make 50 to volunteer for today. But this morning, I think we turned away some people because ang nilabas lang na bakuna, 100, and they vaccinated the 125. And some people were turned away for tomorrow. So looks like nag-change, no? With the bandwagon, with seeing all the Dr. Legaspi, Dr. Salvania, myself having ourselves vaccinated, siguro parang typical Filipino, ay sila nagpabakuna, papabakuna na rin kami. So it was good. The mood at PGH this morning was very positive, and I was happy that many of the doctors and nurses came forward to volunteer. Hindi sila pinilit. Some of them were not listed, but they decided. And then now, sabi nga, all those that asked for AstraZeneca should change their survey. Kasi nga, biglang dadami yung demand for Sinovac. So pinapa-change sila ngayon. That's an online survey. They need to change their choice. Kasi parang mahuhuli ka eh. If you're still going to wait for that vaccine, you can get infected tomorrow or day after tomorrow, and that vaccine is still not here. It's a better vaccine, but it's not here. So you get what's available.
Doc, do we have any new numbers percentage-wise?
Yeah.
Of
those who want to take Sinovac now.
Of the ones who volunteered.
You know, with the response earlier and the people watching, you know, the typical Filipino is a fence hitter.
Yeah.
They'll watch, and then if they see these heads and officials getting vaccinated, I think a lot of them will line up tomorrow. So our allocation of 1,200 yung pinadeliver sa PGH, 1,200 doses. I think that will be consumed in a day or so kasi matatapos yan because I think the people are realizing naman the value of getting vaccinated earlier than waiting, hindi mo alam kung kailan eh. So baka next month yan or after 2 months or baka hindi pa dumating yan.
Now, Doc, assuming na dumating na yung mga vaccines from wherever, obviously today was a very, very controlled first wave, and kaunting-kaunti pa, very manageable. Once dumagsa na, both the vaccines as well as people wanting vaccines, what are your concerns? I mean, beyond questions of efficacy and safety, and even beyond questions of low confidence, assuming people want it, what are your concerns on the logistics side and in the actual rollout on a national level?
Correct. The biggest problem in any vaccination program is really the rollout of what they call the supply chain management. So making sure that the 600,000 doses are delivered to the hospitals that are going to vaccinate, diba? To Cebu, to Davao, tomorrow we'll be going to the local government hospitals. I'm assigned with Secretary Galvez to visit Pasay City General Hospital. Some of the other secretaries will be going to Manila, I think, to the Santa Ana Hospital, the Secretary Duque. So this is the next year. Kanina were all the COVID hospitals and the military hospitals. Tomorrow will be the LGU hospitals. So we will be vaccinating health workers in the LGU hospital. I think the biggest problem really is the supply chain management. And like kanina, I had some criticisms to our PGH kasi the nurse that aspirated the syringe, the vial, and injected me was the same person typing in the computer, my record, waiting for the print. I said, can't we just
Nag-multitask ka.
Oh, sabi ko, you should be just injecting. Get another person to do the encoding. So by the time you jab me, there is another area.
Yes, right.
So may improvement pa. So I'm glad 100 lang. Kasi usually on the first day, dun ka naman magkaka-problem in any endeavor na malakihan. So I'm sure they can improve it some more. They're targeting 800 to 1,000 a day. So I hope dumating yung mga tao tomorrow and the rest of the personnel can get vaccinated. But na-surprise ako na we were actually scared in PGH na walang sisipot at walang magpapabakuna. In fact, what we were thinking of is saan tayo kukuha ng mga ibang health professionals na gusto magpabakuna. But surprisingly, people came forward. Doctors, nurses came forward and said, well, they'll have their jab. And
Pero yung numbers namin sa news, 150 lang over 1,200.
No, that was really the ceremonial. Because it's ceremonial, we were asked to prepare 100 vaccinees.
Okay. So symbolic lang.
Symbolic lang siya. Kaya nga mga leaders ang pinag-inject. And then of course, yung mga nando doon na gusto na magpabakuna, nabigyan na rin sila. So, gano'n.
So okay. So in the next, how many days you'll be rolling out the 1,200? Is that it?
Yes.
Ganun ba yun?
We will ask for more if tumaas yung confidence level ng personnel and magkaroon ng bandwagon mentality na since they got theirs, I'm going to get mine. I'm not going to wait for the next vaccine, the better vaccine in their idea.
Yeah.